Contraceptive access in Utah during COVID-19, prepared by Family Planning Elevated. Please contact us at 801-839-5356 by call or text with any questions, or visit www.fpeutah.org. With the coronavirus pandemic impacting so much of our daily lives and the systems we rely on, many Utahns may be unsure how to get the contraceptive care they need safely and affordably. At Family Planning Elevated, we're working directly with community health centers, pharmacies, and policymakers to ensure Utahns can access contraceptive care in their communities. Below, you'll find answers to common questions about where and how to access contraception during this difficult time. For more information, email Family Planning Elevated at hello@fpeutah.org or text or call us at 801-839-5356.
I lost my job and I don't have health insurance coverage. How can I afford contraception? Let's talk through a few options. Number one, Medicaid. Many Utahns may now be eligible for Medicaid, which covers all FDA-approved contraceptives without a copay. You can apply online or contact Take Care Utah for assistance with your application. Family Planning Elevated Contraceptive Access Program. If you're uninsured but you don't qualify for Medicaid, you may be able to receive contraceptive services and methods free of cost at participating health centers throughout the state. Find more details on our website or contact us directly at hello@fpeutah.org. Bedsider BC Benefits Program. BC Benefits offers reimbursement for one contraceptive visit, including remote consultation, and up to a year's supply of your chosen contraceptive method. Visit the BC Benefits website to see if you qualify. Planned Parenthood of Utah. Planned Parenthood of Utah is another option for low-cost contraceptive care. Their health centers remain open during the COVID-19 outbreak, but with limited hours. You must call before visiting in person. 1-800-230-PLAN. Telehealth services are also available if you need to start birth control or refill your prescription. Email Planned Parenthood at callcenter@ppau.org or call 801-532-1586.
I need a new prescription for birth control. How can I get one? There are several options for accessing prescription contraceptives, some right from your home. Telehealth. In an effort to keep patients and healthcare staff safe, many health centers across Utah are offering family planning telehealth visits to connect patients and providers virtually using a phone, tablet, or computer. Your provider can write a prescription for birth control pills, patch, ring, emergency contraception, diaphragm, or cervical cap that you can pick up at your local pharmacy. Some health centers are able to mail your method directly to you. Contact Family Planning Elevated for help locating a family planning service provider near you. Mail order services. There are a number of online services that provide telehealth and mail order contraceptives. Some of these options have out-of-pocket costs for the initial consultation, and the price of contraceptives varies depending on your insurance coverage. Check out this overview for more information about each online service option and its cost. Pharmacy. In 2019, Utah passed legislation allowing pharmacists to dispense contraceptive pills, patches, and rings to clients 18 or older without a prescription. After reviewing your health history and taking your blood pressure, a pharmacist can help you select a method that works well for you. This service is not currently covered through insurance, so out-of-pocket costs may be high, even if your birth control method is covered through insurance. Check here for a list of participating pharmacies. Note that you may want to call ahead to check that your pharmacy will be open, as some pharmacies have reduced their hours of operation.
My life is in major flux right now. Can I get enough packs of birth control to get me through the year? To start, ask your provider to prescribe a full year's supply of contraceptives. This means 13 packs if you have a monthly pill bleed, or 18 packs for continuous cycling. Pharmacies or insurance plans may limit the number that can be dispensed at one time. So ask your pharmacist what the maximum amount is for your circumstance.
Can I still get an IUD or implant? And what happens if I want it removed? Many clinics are continuing to offer IUD and implant insertions and removals. If your provider cannot see you for these services, please contact us to find a clinic near you. We are committed to supporting your right to choose to use these methods when you want, and your right to choose to stop using these methods when you want. Is self-removal an option? While we recommend IUD clients schedule an in-clinic visit for IUD removal, some clients may be interested in discussing the option of self-removal with their provider. You can learn more here. Implant removals should only be done by an experienced healthcare provider. Should I use a backup method if my IUD or implant has expired and I haven't been able to take it out? You may be surprised to learn that some methods continue to be effective well after their labeled duration and won't cause harm if they remain in your body. Strong evidence shows that IUDs and implants are highly effective for 1 to 2 years longer than their FDA-approved length. For example, the Mirena hormonal IUD has been approved by the FDA for 5 years, but studies have shown that its duration is highly effective for up to 7 years. Similarly, the Liletta hormonal IUD has been approved by the FDA for 6 years, and studies have shown it to be highly effective for up to 7 years. The Paragard copper IUD has been approved by the FDA for 10 years, but studies have shown it to be highly effective for up to 12 years. Finally, the Nexplanon implant has been approved by the FDA for 3 years, but studies have shown it to be highly effective for up to 5 years. If you have a Skyla or a Kylena IUD, these methods should be removed at their FDA date and are not shown to be effective after that time. If you're approaching a time frame where you need to get your IUD removed and are concerned about your method's effectiveness, you can use other methods with your IUD or implant in place, including contraceptive pills, barrier methods such as condoms or diaphragms, and vaginal rings. For support in figuring out removal of your expired IUD or implant, please contact us.
What if I need emergency contraception during the pandemic? Emergency contraception, or EC, is birth control you can use after sex to prevent pregnancy. It is sometimes called the morning after pill. While EC is used after sex, it is not an abortion pill and will not stop an existing pregnancy. Levonorgestrel, such as Plan B or Next Choice, is an over-the-counter EC pill that's available in most pharmacies. Ulipristal acetate, called Ella, is another type of EC pill that can be used up to 120 hours or 5 days after unprotected sex and works better to prevent pregnancy than Plan B for people with higher body mass index. Unfortunately, unlike Plan B, Ella must be prescribed. Consider asking your provider ahead of time for an Ella prescription in the event that you need EC during the coronavirus pandemic. You can also purchase EC online through several mail order services. The most effective form of EC is the copper IUD, which is almost 100% effective even 5 days after unprotected sex. If you are interested in the copper IUD, let your provider know that you want it for EC so you can be scheduled quickly. For help finding a clinic, contact FPE, hello@fpeutah.org. You can also learn more at our website, fpeutah.org.
How can I get my next depot shot? Check with your clinic or provider to see what their current protocol is for the shot. Many clinics are still providing this service. Your provider may also be able to prescribe you Depot Sub-Q, a pre-filled syringe designed to be injected just under your skin, which means you can pick it up at the pharmacy and inject it yourself. If you are concerned because you've gone past your scheduled appointment for the shot, you may be relieved to know that Depot continues to be effective after 12 weeks. Just be sure to receive your next injection within 16 weeks of your last shot to stay protected from pregnancy.
What if I need affordable condoms and other safe sex supplies? Condoms can be purchased at most pharmacies and grocery stores and are available at no cost through FPE CAP clinics. Sister Reach, a nonprofit based in Tennessee, is mailing free safe sex kits with condoms, dental dams, lube, and emergency contraception. Visit the Sister Reach website to request your free safe sex kit.
I'm experiencing an unwanted pregnancy. What are my options? Currently, options for an unwanted pregnancy are similar to what they were before the pandemic. Individuals can get a surgical abortion or a medication abortion, the abortion pill, through Utah's 2 licensed abortion clinics. Planned Parenthood Metro Health Center can be reached at 801-257-6789, and Wasatch Women's Center can be reached at 801-263-2111. Although abortion is legal and available in Utah, patients must complete a consent module at least 72 hours before an abortion visit. Visit the Utah Department of Health website here for more information. If you're struggling to cover the cost of an abortion, funds may be available. Contact the NAF Hotline Fund, the National Network of Abortion Funds, or the Utah Abortion Fund. Similarly, adoption organizations are continuing to support people wishing to use adoption services. If you need support in navigating adoption, here are some additional resources that may be helpful. Birth Mother Assistance website for people wanting information on adoption, and here's the link, as well as Children's Service Society, which offers counseling for people considering adoption. Their phone number is 801-355-7444.
I don't feel safe staying at home with my partner. Where can I get help? While the state of Utah has issued stay safe, stay home orders, we know that some Utahns are not safe at home. If you need help safety planning or relocating, please contact one of the following resources. The Utah Domestic Violence Coalition's Link Line at 1-800-897-5465. They can help you connect with a service provider in your area. The National Domestic Violence Hotline, 1-800-799-7233, or live chat with one of their advocates. The YWCA Utah has a 24-hour crisis line for residents in the Salt Lake area. They can be reached at 801-537-8600 or toll free at 855-992-2752. The Rape Recovery Center's 24-hour crisis line is also available at 801-467-7273. Finally, Utah 211 lists statewide resources available for residents experiencing domestic violence and abuse.